PCSK9 inhibitors really have terrific data at this point in time, both with respect to effective LDL reduction, safety, and now even clinical outcome reduction. The data from the Fourier trial with evolocumab, for example, showed a significant reduction in important ischemic events in patients with stable atherosclerosis, whether that was coronary artery disease or cerebrovascular disease or peripheral artery disease. So people that are clinically stable who are getting good therapy with statins and have LDLs that are reasonably well controlled still benefited from the addition of evolocumab with no detectable downside in terms of some of the things, at least certain people and doctors were worried about, neurocognitive dysfunction, for example. No evidence of that in a carefully done sub-study of Fourier. So overall, really good risk profile, really good efficacy in important clinical events, and an advance in terms of what we can do in patients with stable atherosclerosis beyond statin therapy. The data for PCSK9 inhibition keeps growing. The data most recently in terms of large outcome trials came from ODYSSEY Outcomes, which studied a PCSK9 inhibitor, alirocumab, and compared it with placebo in patients who are already receiving good background therapy, including statin therapy. And in these patients who had had a recent acute coronary syndrome, approximately 1 month to a year prior, there was a significant reduction in ischemic events. And additionally, at least in terms of nominal statistical significance, a lower rate of all-cause mortality as well. And I think that really does advance the field in terms of A, validating the hypothesis that lower is better with respect to LDL cholesterol, and B, that it can be done safely and effectively with PCSK9 inhibition.